Dr. Burkhart, thank you for your time and thanks for joining us.
Thank you.
We talked with someone else about anxiety, and we discovered everyone deals with at least some level of anxiety. Do all of us at some point probably deal with at least mild depression?
Yeah, I think part of the human condition is the fact that we do have anxious moments and we do have sad moments, right? I mean, to put it into terms here at the university, you might be anxious if you're having a test.
Yeah.
Or something that might all make us sad is sometimes we go through some grief and loss. So there is different variations of both of those things that can happen in the human experience.
With all of your studies and training, is there some mark, like after 3 days of feeling blue, that's automatically depression? Or does it just vary in each individual where this has gone on too long? If you haven't started to come out of this a bit, we might want to talk or get some help.
So if you look at the Diagnostic and Statistical Manual, which is how we diagnose it, they say you're having a certain amount of symptoms for at least a 2-week period, right? So from a clinical perspective, if somebody comes in and there says they're having some sadness and some other things, other symptoms, that's what we would start to look at as the marker to make that diagnosis. But sometimes some people will go months having those things and they wait to a point where actually their functioning, their daily functioning starts to become more impaired than just being sad.
When I talk about subjects like this, I can only think about personal experiences. I don't believe I've ever dealt with real diagnosed depression, but I've had periods of time where I just can't seem to shake this funk I'm in. Nothing seems to make me happy and I'm short-tempered, but I get out of that.
Sure.
So that's normal. If you don't shake it and get out of it, that's when we start seeing some real serious effects of what could happen.
Absolutely, and I think we all have depressive episodes. I think sometimes that stigma of somebody saying, I'm in this funk, people get a little nervous to actually admitting that they've had a little bit of depression when it can be very recoverable, as you mentioned in your example.
It's much more annoying than an illness that you know you're probably going to get over, a cold, even the flu, something that you have to take antibiotics for. It's frustrating because you don't know why you're depressed or how to get out of it.
Yes, and with people that have more true depression or major depression, to be more specific, they're getting affected in a lot more areas. They're going to have problems at work. They're going to have problems interpersonally. If they're going to school, they might have problems with school. So you're starting to look at, now I'm declining and functioning in many areas of my life. And so that's another kind of indicator that something more is going on than just a mere funk, if you will.
I would assume people who aren't trained don't know how to help themselves get out of it, so they need to seek professional help. But I imagine that's a hard step for someone to take for a variety of reasons, to call you up and go, I've been depressed for a week and I want you to get me out of it. That's probably a tough call to make.
It is, and sometimes it's even still recognizing the fact that you have to make the call.
Yeah.
Sometimes being sad or depressed is what people use as the judge. But when I speak with folks, they start to miss all the little things. Basically what I would call their daily living activities. So they're not caring for themselves as much, whether that be I'm not brushing my teeth as much, I'm not combing my hair. Maybe if it's a male, I'm not shaving and I usually shave. If it's a female, I'm not, doing my makeup like I should. I'm having changing patterns in my eating, whether it's too much or too little, my sleep. So those are like little day-to-day things that I think people kind of glaze over, that by the time they get to me, they already have their depressed mood, they're complaining of other symptoms, but it's all these other little things that are really kind of getting in their way, and that's sometimes where we start to work at, just to kind of bring them back up and help. But back to your original point of making the call, it's always very difficult. And stigma about mental health is still so prevalent that even if we know somebody that has it, we're still reluctant to discuss it.
Why is it increasing? Why are we having more depressed people than we used to?
It's such a great question. I mean, in fact, when the WHO put out the article, I think they felt so strongly enough, they're actually starting to run a campaign about it to help people do that. I would say, one of the things could be is we start to recognize it more, right? Like before, in the 60s, if somebody had depression, they just tell you to toughen up and you kind of move on with it, right?
Yep.
Or even if you look at other things that we treat in mental health, like ADHD, you were just a troubled kid. But now we know it wasn't really a troubled kid. The kid was struggling because they had ADHD. So I think awareness about just what it is or what you're looking at actually helps you get those numbers. And noticing that depression affects so many other medical illnesses that I think is also bringing awareness.
We're going to end this interview with a note of optimism, but just before we end with optimism, depression is dangerous if left untreated, isn't it?
It can be, absolutely. You know, unfortunately, people, if they get to a bad point in their life, they would think about death or dying, and they might do something themselves, or they just start to give up and stop taking care of themselves.
Which is just a slower death. Really.
It can be, and especially if you have medical problems. So yes.
Now, optimistic, can you and other physicians who are trained like you are, can most people be helped no matter what level they are in their journey of depression? Can you, through a variety of means, help most everybody that seeks out help?
Absolutely. I think everybody can always see somebody or work to get themselves a little bit better to help relieve some of their symptoms. Right? There is always, I'm an optimist in that way. I really do believe that. I mean, I think it's work on the person. It's also work on the doctors that they see. But this kind of goes off on a little bit of tangent. But I had a patient today, and she's been struggling for a while, and she looked wonderful today. I mean, she was smiling more. She started working a little bit again. She started eating a little bit again. Her and I have been on a ride for, a little bit over a year, and she struggled with some really hard things. But you know, here she was doing all these things that her and I had been talking about. And mind you, I'd love to take the credit, but she really did a lot of the hard work on her own. So yeah, I mean, people can absolutely address that and do that.
Good for her, but
Yes.
that's your reward too, seeing her improve, much to her credit. But that must be your good day when you see her improve.
Oh, it was one of the funnest things I've gotten to see all morning so far. So yes.
You get depressed,
Sometimes.
but you kind of know how to deal with it.
Yeah, I mean, I think it's part of the human experience.
Yeah,
You have some hard times. You know, I've had loss in my life,
Yep.
and so you have to go through that. But then you always recover from it.
I could ask you a lot more questions, and we'll do that the next time we talk.
Okay.
Thank you so much for your time today. I enjoyed it, Dr. Burkhardt.
Wonderful. Thank you so
Thank you.
much.